Capturing temporal structure with TSNE. Epilepsy is a pervasive disease that affects over 50 million people worldwide. However, unfortunately, over 30% of patients do not respond to medications and are considered refractory. Refractory patients are the set of patients where a traditional treatment pattern does not work. This means, in our context, that they fail 3 or more distinct treatment patterns where a treatment pattern is a combination of treatment drugs. The medical community knows little about this cohort, so diagnosis is difficult. Because this cohort is relatively unknown, this leaves the possibility for further exploration through machine learning. By exploring the temporal aspect, we are able to understand the data better and can possibly give doctors actionable insights. For our experiment, we will construct a cohort from a rich data set of over 30 million patients. Temporal features will be constructed for each of the patients. These patients will be embedded into a 2D space using TSNE, a complex dimensionality reduction algorithm that is further explained in the manuscript. Clustering will be performed on these two-dimensional features to compare against the temporal results and determine how to better utilize these results. D3 was used to construct these visualizations. As you see here, we have the weighted average temporal score. The temporal score relates to the average location of the events for a patient. Darker or closer to 1 means that the weighted majority of events occurred later, whereas values near 0 mean that the events occurred earlier for a patient. As you can see, TSNE does a good job of grouping the patients. We have clusters near the top right where the majority of events happened towards the end, and in the middle bottom we have a cluster of patients where the majority of events happened in the beginning. Temporal understanding is crucial for being able to visualize temporal events. TSNE is an excellent medium for displaying high-dimensional data in a 2D visible plane that anybody can understand. To move further, we can incorporate supervised results to improve robustness of these results and determine next steps for the analysis. Thank you.